Hello, I'm Duane Townsend. I'm a physician. I'm board certified in obstetrics and gynecology and gynecologic oncology. That is the diagnosis and treatment of the female reproductive tract in women. I'm 75 and a half years young. I feel fantastic. I have incredible health. I've had an exciting life, and I really changed the practice of medicine during my 50 years of medical practice. I've been a professor at UCLA, USC, and University of California Davis Schools of Medicine. I introduced cryosurgery of the cervix to medicine. I introduced nurse practitioners. I popularized a technique called colposcopy used in women with abnormal pap smears. I also helped develop a technique where we use radiation therapy with chemotherapy to improve the outcomes in women with advanced cancers of the cervix. And more recently, I introduced a technique called rollerball endometrial ablation to avoid hysterectomy in women who had heavy periods. Well, more importantly, in the last decade and a half, I have found something that I consider an absolutely amazing peptide. It has given me health beyond belief. I travel, I have great fun, and my bucket list keeps growing and growing because I'm in no hurry to take advantage of this spectacular health that I now have. I'm going to talk to you about a number of things that are very important in our lives. Listen carefully, because the things I tell you can change your life as it has changed mine. Let's talk about a condition called PMS, or premenstrual syndrome. This is a condition often characterized by breast tenderness, some weight gain, bloating, discomfort, usually occurring just before the onset of a menstrual cycle. And once the menstrual cycle takes place, it is often heavy. But once it's over, you feel great. Why is this taking place? Well, if you look at the hormone levels in women with premenstrual syndrome, they often have relatively high estrogens compared to progesterone. This is often called estrogen dominance. So there's an imbalance of the hormones. What can be done about this? Well, diet does play a major role because Japanese seldom notice PMS, and more importantly, they don't have hot flashes in the menopause. So diet plays a role. So watch your diet. Don't eat too many sugars, and do some exercise. This will also lessen PMS. This often is not enough, and women still have a problem. And this can create many problems in the household. The husbands know what's going on, they're unhappy, and the wives are unhappy, and can lead to very, very serious times in the marriage. We have found that one can use some natural products to correct this problem. And these natural products actually prevent the binding of estrogen on estrogen-sensitive tissue. Now, estrogen will stimulate estrogen-sensitive tissue to undergo more activity. This may account for breast tenderness and for heavier menstrual flow. Well, if you can block this stimulation, you should be able to see a lessening, of the symptoms. And indeed, this does take place. Amazing little molecules that help reduce a woman's problem as she enters the premenopause area. If you'd like to learn more about this and learn how to get a free consultation, go to my website, Ask Dr. Townsend, and you'll learn much more about how to conquer this troublesome problem.